Hello, are you using metformin containing tablets for your diabetes management? Then you have to know this important information for your healthy nervous system. There are several research articles published, especially since 2019, which discussed the causal link between metformin use and vitamin B12 deficiency. Finally, brand leader of metformin, who is Merck Pharmaceuticals, had included vitamin B12 deficiency as the common adverse reaction for metformin use, which may affect 1 in 10 people who are using metformin containing tablets. And in June 2022, UK Health Authority MHRA has also published a safety update to bring more awareness to public on this common side effect to enable metformin users to correct their deficiency with relevant diet and methylcobalamin supplements. What are the medical consequences of B12 deficiency? It can lead to either minor or major health issues. Minor issues are like a persistent fatigue and muscle weakness, smooth red and sometimes painful tongue, which is glossitis, which is a common symptom of B12 deficiency. Mouth ulcers, again, digestive issues, like some people may experience diarrhea or constipation, and also loss of appetite, including the digestive issues that can lead to unintentional weight loss. Now, let's look into the major health issues because of vitamin B12 deficiency. So, it can lead to a type of anemia which we call pernicious anemia, where the body produces fewer blood cells than the normal, which can lead to fatigue, pale skin, and shortness of breath. So, these three symptoms like fatigue, pale skin, and shortness of breath are common symptoms of B12 deficiency. And nerve damage. So, B12 is crucial for the myelin sheath, which is kind of protection for the nerve fibers. Deficiency of B12 can lead to nerve damage and causing numbness, tingling, pain, and particularly in the hands and feet. So, if you experience any tingling and pain sensations in your hands and feet, that could be a nerve damage because of B12 deficiency. Balance and coordination problems. Any neurological damage can lead to difficulty with balance, coordination, and walking. Memory loss and cognitive difficulties. B12 is essential for brain function, and also deficiency can cause memory loss and difficulty in concentration and cognitive impairment. B12 deficiency can also impact vision. So, because of the damage to optic nerves, it can lead to vision problems like blurred vision or double vision. So, B12 deficiency can also uh, lead to the issues of mental health, psychological disorders like depression, mood swings, or irritability. And also, psychosis is one of the medical consequences of the severe B12 deficiency, like paranoia and delusions. B12 deficiency can also contribute to heart problems such as heart failure and also to impact on the fertility of um, men and women, which can increase the risk of pregnancy complications, especially the birth defects. So, in which patients the risk of B12 deficiency is high? The patients who are using metformin at higher doses or who are using the metformin since very long time are at very high risk for having the B12 deficiency, and also patients who have the gastrointestinal disorders, especially the elder patients having underlying medical conditions like Crohn's disease or any other inflammatory bowel disorders, autoimmune disorders, and patients who are under strict diet, like they are not having any animal products like milk, egg, yogurt, or any meat into their diet, and also people who are using the concomitant products of proton pump inhibitors, especially the gastric medications like pantoprazole, rabiprazole, omeprazole, and also patients having genetic factors for the reduced absorption. That means patients who have, due to some genetic reasons, they have some impaired absorption of B12 into their bloodstream. So these are the high risk factors where the patients can develop high B12 deficiency while using the metformin. Let's look into the strategy for preventing B12 deficiency risk when patients are using metformin containing medicines. So the strategy contains three steps. The first step is, which is very important one, to aware and observe for any signs and symptoms of B12 deficiency. So there are symptoms which are associated with B12 deficiency. Let's look into the first category, which is most important symptoms to observe, the neurological symptoms. If you observe any tingling, prickling, or numb sensations in your hands and feet, which is a common symptom, and also if you observe any muscle weakness and difficulty with balance and coordination, and also if you have any difficulties in the walking, trouble walking, and if you have any problems with memory, understanding, and judgment, and if you have symptoms of psychological problems like mild depression or anxiety or confusion to dementia, and also if you have issues of urinary incontinence like loss of bladder control. So these are the common neurological symptoms. So along with this, if you observe any general symptoms like fatigue, like feeling very tired or feeling very weak, which is very common early sign for B12 deficiency. If your skin turns pale yellow in comparison, okay, pale skin, and if you have any difficulty breathing issues or rapid breathing, like kind of shortness of breath, if you develop any headaches, which is a common symptom along with the combination of other symptoms like indigestion or stomach issues and loss of appetite and palpitations, or which means the reduced or irregular heartbeat, diarrhea, digestive issues like diarrhea can happen, and unintentional weight loss, that means weight loss which is not planned, and if you observe any nausea and vomiting along with other general symptoms like sore and red tongue, glossitis, mouth ulcers, burning sensations like in the burning sensations in the mouth or burning sensations in the tongue which can occur, and if you observe any other symptoms like vision problems, mood changes like irritability or mood swings, changes in the smell or taste can occur, and if you observe any reduced reflexes, and in some cases like uncontrollable muscle movements which can occur in the B12 deficiency issues. So these are the common neurological and the general symptoms which you have to be aware and observe for taking the early action. Okay. Step 2 of our strategy to prevent B12 deficiency is to check your B12 levels through routine tests, especially for the patients who are in the long-term treatment with the metformin medications. Then the step 3 has to be executed whenever you have been diagnosed with the B12 deficiency by your doctor, or if you have observed a decreased trend in the B12 levels through your consequent blood test, then you have to consider compensation of the B12 in your blood with the usage of supplements. So you can use the supplements like methylcobalamin as per your clinical advice from your doctor or your healthcare professional. Then you can maintain your B12 levels within the normal range. So thereby, which can prevent the serious medical consequences which we have seen, and then maintain your health along with the effective uses of metformin tablets. I hope this information is useful for your health in preventing the B12 deficiency while using metformin tablets. Thank you.